food, availability of food, control of marketing, pricing of food, and all of that. Now, a couple of years ago, the WHO said, oh, come on, what's happening here? Can you, WHO, tell us a bit more what we need to do to reset the situation? And that's what we did. And then we launched a plan to accelerate actions to stop obesity. And luckily, it has been a very good response. Luckily, we now have 32 countries, but it's increasing very quickly. The number of countries say, okay, we got it. And they're not going to be any longer dictated by the private interest, because let's be honest, the private interests are the ones who have stopped the establishment of effective, cost-effective policies to shape the food environment. So that's changing. We have 32 countries. They are really taking serious action to change the pattern. And I'm very pleased to hear from Mr. Custom that Jamaica is so clearly, looking at priorities, which is reshaping the food environment, but the action in public institutions, particularly schools, that's what we plan, creating a healthy food environment for children, allowing them to be physically active. Let's not forget about the other aspects about lifestyles, for example, sleeping patterns. So all of this is changing. But the other important thing that these countries are doing is that they're also understanding that health systems need to change. So health systems need to recognize obesity as a disease that requires treatment. And the 1 billion people need to have adequate care for that. Now, adequate care means many things, and actually WHO has developed a framework for service delivery, so it has to be done across all the levels of the health care. It has to have well-trained health workers to be able to recognize and act. It has to be providing this to all. So we shouldn't create big differences. For example, related to the fact that only some people can afford pharmacotherapy. WHO is also looking at when this kind of approach is needed. So we need to have an integrated approach where people are supported to change their diet and physical activity behavior, their lifestyle in general. If needed, and only when needed, they will need other kinds of support, whether it's surgical treatment or it's pharmacotherapy. So we're actually about to release guidelines for the management of obesity in children and adolescents. And we're certainly going to talk today about these new drugs. We're actually looking at the science around the drug, and we're trying to make recommendations very quickly to see who is actually benefiting from the drugs, for how long, as part of what management protocol, and then who is going to support them.
Thank you, Francesco.